On diagnosis, the patient will be dyspneic, that is, they will be short of breath. This is because their alveoli are filled with fluid, which will impair their gas exchange mechanism. The patient will initially be having a non productive cough, which will turn into a productive cough as the disease progresses. They may also have chest pain, fever, hemoptysis, and cyanosis. Cyanosis will be caused due to hypoxemia as their gas exchange mechanism is impaired due to consolidation of the alveoli. The hemoptysis will be caused because the RBCs may also move along with the fluid into the alveoli. On palpation, there will be an increased vocal and tactile fremitus. This is because vibrations travel better from a fluid-filled or consolidated tissue. On percussion, there will be dull sounds as there is less movement of air, and on auscultation, there will be decreased breath sounds to the affected area. And inspiratory crackles may be heard as the alveoli are filled with fluid. The vitals will show an increase in the heart rate and the respiratory rate, which occurs in response to the hypoxemia. There will be an increase in the temperature of more than 38 degrees Celsius and an increase in the WBC count of more than 1000, which shows the presence of an infection. The chest X-rays will show infiltrates and consolidation, which will appear as areas being more wide. The ABGs will show results that indicate hypoxemia with hyperventilation. This chest X-ray is of a patient having a unilateral bronchopneumonia. As you can see, the left lung has become completely consolidated. In this chest X-ray, the patient has lobar pneumonia. That is, the right middle lobe of the lung has become affected. It is seen as the area that is more white in the right lung. A culture and sensitivity test may be performed by collecting a sputum sample and allowing the microbes in it to grow. A culture test is done to find which germ is causing the infection, and a sensitivity test checks to see what kind of medicine or antibiotic will work best to treat the illness or infection. Treatment of pneumonia depends on the type and severity of the disease. Antibiotics are commonly given to fight the infective agents that cause bacterial pneumonia. The antibiotics may be broad or narrow spectrum depending on which bacteria is responsible for the disease. Some of the drugs used are penicillin, cephalosporin, and tobramycin. If required, oxygen therapy may be given if the saturation is below 90% and if the PaO2 is less than 60 mm mercury. Oxygen therapy is used to treat the hypoxemia and decrease the work of breathing. Ventilation may also be provided if the patient fatigues and hyperventilation occurs. This may happen if the patient was initially hyperventilating because of the presence of hypoxemia, and over time their muscles may have become weak and could no longer work properly. Preventing the spread of infection is important, especially in a hospital environment. As the patients may be immunocompromised, the microorganisms will be able to infect the patient much more faster. These microorganisms will be stronger and more difficult to treat, and they may also be resistant to treatment.
Created using Powtoon.